Have you ever had a door in your house that sticks? The hinges are fine, the handle works, the wood itself isn't damaged, but somewhere along the way the frame shifted just enough that the whole system stopped working smoothly. You could sand down the edge of the door every few months to make it easier to open, or you could step back and ask, why isn't this door sitting properly in the frame anymore? That's one of the ideas behind something I learned in structural integration school called Spatial Medicine. Now, I hesitate to use the word medicine because I hesitate to use the word medicine because it can sound like I'm talking about diagnosing diseases or treating organs themselves, but that's not what I mean. Spatial medicine is really a way of looking at the body through the lens of relationships and positioning. Instead of asking only how is this structure functioning internally, I can also ask how efficiently is this structure able to function within the space it's been given. How are the bones aligned? How are the muscles balancing tension? How are the muscles balancing tension? How are the organs suspended and supported? How is the fascia the connective tissue that links everything together, allowing movement and adaptability? Because your body isn't just a collection of separate parts, it's an ecosystem. Everything has to coexist and move together. Take your lungs, for example. Traditional medicine is incredibly good at looking inside the lungs. It can assess infection, inflammation, oxygen exchange, and structural disease. Spatial medicine asks a different question. Do the lungs have enough freedom to expand? Can the ribcage move well? Does the diaphragm descend efficiently when you breathe, or is the surrounding tissue creating unnecessary restriction that forces the body to work harder just to accomplish a normal breath? It's not replacing the medical perspective, it's adding another layer to it. Here's another example. Think about your digestive system. If you've ever worn pants that were just a little too tight around the waist, you know that everything feels compressed. You don't necessarily stop functioning, but comfort decreases and efficiency changes. The same idea can apply inside the body. Our organs don't just float randomly around in empty space. They have attachments. They glide against neighboring structures. They move when we breathe, twist, bend, and walk. If those relationships become restricted, the body often adapts. And adaptation is one of the things that the human body does best. The problem is that adaptation isn't always efficient. Maybe your shoulders start hiking upwards because your rib cage isn't moving well. Maybe your pelvis shifts because one side of your body is carrying more tension than the other. Maybe your neck works overtime because your thoracic spine has become stiff. The body will almost always find a way to get the job done. It just might not be the most economical way to do it. I often explain fascia as the body's internal organizing system. It's the fabric that helps hold everything in relationship to everything else. Bones provide structure, muscles create movement, organs perform specialized functions, but fascia helps coordinate the spatial relationships between all of them. When I work with clients through gentle myofascial release, I'm not trying to force the body into some ideal posture or textbook position. I'm listening for where the body seems to have lost options. Where has it adapted? Where has it stopped moving as freely? Where is one area doing too much because another area isn't contributing enough? As restrictions soften and the body reorganizes, people often notice surprising changes. Sometimes pain decreases, sometimes breathing feels easier, sometimes movement becomes more fluid. People often tell me they feel lighter, more upright, or simply more comfortable in their own skin. Not because we fixed a broken part, but because we helped restore a more efficient relationship between parts that were already designed to work together. I think that's what fascinates me most about this approach. It's less about chasing symptoms and more about creating an environment where the body can function with less effort. Because health isn't just about whether individual pieces are present and intact. It's also about whether those pieces have the space, support, and freedom to do what they were designed to do. Maybe that's what spatial medicine really points us towards. Not a body that's perfect, but a body that's organized well enough that life feels easier to live within it.